Hi, this is Laura Cazell giving you my experience on recovering from rotator cuff surgery. This is my second one. This is on my right side, my dominant side, which makes it a little bit more difficult than my last time, which was 2 years ago. I want to talk about the day of surgery and the pain and medicine and a technique to get yourself moving the first time that is super helpful to myself, and just to share what I learned. So, by the way, the day of surgery is like the easiest day, other than the waiting part. Once you wake up, you're already in your sling. You've got a nerve block probably they used on you, so you're pretty numb for another 16 to 24 hours. So you're not feeling any pain at all, and you're just incapacitated and getting iced and hanging out at home. So for me, that was Friday. On Saturday, you're basically taking the heavier medicine all the time. And I take a tramadone. I didn't want the oxycodone, for obvious reasons. So I took the tramadone and was fine with just that, both last time and this time. And I really only took it as prescribed for the whole second day. Again, with that, you're also taking ibuprofen and acetaminophen or Tylenol. So the third day is when you can start trying to not take as much. For me, it was tramadol. So I woke up and I took one, and then I was just waiting to see if I could last the whole day without taking one. I think I ended up around 3 or 4 o'clock being really grumpy and having some pain, so I took some, one then and at night. And then yesterday and today I have taken none. So by the if day zero is your surgery, by day three you could be totally off any of the heavy medication and just try and elongate times between it and not take it and see what happens. Because honestly, by day three, everything is much less painful. And honestly, there's way worse surgeries you can have for pain than the shoulder surgery. So I think that when I saw the videos of people talking about it, the pain was way overrated. And I know it's an individual thing, but just realize that I only spent one full day on the heavy drugs the second day, and after that I weaned off everything. And so my surgery was Friday. It's Tuesday, and all I'm taking right now is ibuprofen, and that is it. And I am still continuing with the ice machine. So that's the scoop on the medicines. They don't really give you much instructions on how to stop taking them, only what to take when you go home. So I thought I'd do a quick thing on how to take less of them. And again, the only thing that makes it hurt is if you watch scary movies day three and you end up, scaring yourself and being startled, because that can be painful. So don't watch scary movies like I did on day three. That wasn't so smart. So if you can avoid that, it's really not so bad. Now, the one technique I recommend that everybody use, because I know the first time I had shoulder surgery, I was very afraid of taking off my sling 48 hours after I had the surgery, which is when you can take a shower. And I heard people crying and talking about it, and it got me really worried and freaked out about it. And let me tell you, at least twice now, so this is two shoulders experience worth, two different doctors, it's not a big deal to do that. And do not be afraid of that. The way that we do it, that I think is smart, and how you can handle a lot of things in life, not just dealing with pain, is you can unhook yourself from the contraption and have it that it can kind of fall out of the thing. But my husband held my hand. He basically took the sling off as gently as you could, leaving your arm in the 90-degree position it is when it's in the sling. And then have him hold your arm. You breathe in, and when you breathe out, he lowered it slightly, just a little bit. And just do breathing exercises. Bring in and lower slightly, and repeat until your arm is hanging at your side. So don't try and do it all at once. Use breathing exercises. You can take as long or not as you can do it as fast as you want. And that's seriously, I do it every day, even on my own right now, taking the sling on and out. So I had my surgery on Friday. It is Tuesday today. and it's already getting way easier to take that sling off. So realize that your improvement will dramatically get better every single day right after you have that surgery. So just expect that, and realize that it really, the first time you do it may be tricky, but then the next day will be better, and it only gets better from there. So use the heavy breathing. Don't stay on the drugs if you don't need to. Just again, I was on it the very first day when I came home, which was nerve block. And when that wore off, I was on the heavy drugs for one full day, and then just one at nighttime and during the day after that, and that was it. Okay, so keep yourself out of trouble and don't be on the medications too long. And I'll be back. Thanks.